Psoriasis.
Ooh, psoriasis. That's a good picture, folks, that we have here about psoriasis. It explains
Mhm.
a lot of what's happening into that scalp. Now, Biz, walk us through the process here. What are we seeing here?
So, like, as the scientific definition of what psoriasis is, it's a non-contagious condition, though it's chronic skin condition. It's not acute as it's going to happen overnight. It's going to happen over a period of time. And it is what happens there, it's a rapid buildup of the skin cells. And there's no elimination of these old skin cells. So it's just build up over each other. And you can see them scaly patches. They can be red, white, or silvery. And if you pick them, the scalp actually bleeds. This is your cue to know that you might have psoriasis as a skin condition. And sometimes, if it is on the usually it's on the scalp, but sometimes you see it on knees and elbows, and sometimes on lower back too. So the exact cause of psoriasis is not fully understood yet, but it is believed to be a combination of genetic and environmental factors. And sometimes it is also an overproduction or an overproduction of the overstimulation of the immune system. It could be an autoimmune disease as well. So
Excellent.
let me just finish this. So basically,
Sure.
as a definition, as a scientific definition of this chronic condition, it could last for years, it could last for a lifetime, nobody knows. And the triggers ranges from stress to infection to medication. There is like they didn't know exactly what triggers it, but there is absolute trigger. And when we do the epigenetic um, or your like a medical history for the client, you might put your finger on the trigger.
Excellent. Carrie, on your experience dealing with people with psoriasis behind the chair, what are the symptoms that you're usually seeing?
Dry, itchy, flaky, painful, irritated. And for you guys out there, I actually have psoriasis myself. I personally have it. I have it on my arms, my elbows, my back of my neck. You do too, Sergio?
Yep, I'm
Yeah.
also a psoriasis survivor.
Yeah. So, and it's, it's not a one size fits all world. And a lot of times when I have clients, I see it, I could empathize because I know too what it feels like, because you have times where it flares up and it burns. I've had times where I'll lean on my elbow and I have a flare up and it hurts. It feels like I just fell off my bike and my elbows are scraped and there's nothing I could do except for play it out. But honestly, like Bisan said, you don't know what the cause of it is, but you could start as a personal, start analyzing your triggers of what, like, notice patterns within 2 weeks of having a psoriasis flare up. What happened? Did you have a stress trigger? And that stress trigger, was it, a mental stress? Was it a food sensitivity? I know now I've narrowed down for me, and again, it's not a one size fits all world out there, but I know for me, mental stress doesn't really flare up my psoriasis as bad as a food stress will. So I know if
Yep.
I've had contamination of gluten, I also have celiac. If I've had a cross contamination with gluten, whether it even be me sitting at a bar counter and they had spilled beer and the beer gluten is on my skin, like actual contact, my psoriasis, I'll flare up. Actually, will start bleeding
Whoa.
within 10 minutes.
Wow.
Or if I've eaten anything, I know too, cheese, as much as I love cheese, I have to go in with, very calculated if I'm going to eat that grilled cheese sandwich or if I'm going to save it for a charcuterie with wine and cheese with my friends. But I know I'm going to have a flare up. Right now I have a small flare up, but I had a girls' weekend with charcuterie celebrating a 40th birthday. So I know the triggers. So when I have clients come in and they talk about the burning sensation, I'll give them advice from my personal experience. But again, psoriasis, it's one of those tricky things. It's not a one size fits all world out there. So
Definitely.
do you
Yeah,
know your triggers?
I have triggers, especially to Doritos.
Oh no.
I love
Doritos.
that thing, and every time I eat Doritos, I get a flare up. And, it's
That's a
funny.
very
It's funny.
interesting
Yeah,
actually.
that's the thing, it's funny
What
how
about cheesies? Do you get flared up from cheesies?
some types of some types of potato chips, cheeses, yeah. I don't eat much cheese, but Doritos, that's my thing, and it's incredible because you get other products, and you don't flare up to them, but there's specific things that in our diet that can trigger that. And as you mentioned, Biz, it's a genetic thing. My father had it. My sisters have it. And it's incredible how in each one of us it shows differently. And that's what many people don't get. They believe that because it is genetic, it's going to show up in the same intensity for everyone else. And it doesn't. It changes. It changes. I have psoriasis. My kids could have psoriasis, and it will show differently in my body than in their bodies. So the expression, the genetic expression changes, though it expresses itself. And that's what it's key about this subject. Now, of course, we can have stress related triggers. We can have food related triggers. We can have medication related triggers, infection related triggers. I mean, there's a tons of things that, can interact into the process and make it flare up. And when it does, like Carrie was mentioning, it can go bad. Now, for some people, it starts like blisters in their hands or on the sole of their feet, which, those blisters are part of the psoriasis interaction as well. And I used to have those type of blisters in the near the elbow area. And yep, exactly. Like inside of the elbow. I don't know how you translate that into English, but
Yeah, they look like little blood blisters, like little.
Yeah,
exactly. It looked like blisters, and
Not like a traditional burn blister. They're like little.
Exactly.
They're like little blood pockets almost. Like
pimples.
Yeah, but not really. They're just like tiny little red blisters. They're tiny.
And the things, they will go, and sometimes for me, and when it happens on my hands, it's like water blisters, but small ones and itchy and burning. I'm like, God, I hate those. And the thing is, you can have it in a few moments, and a few hours later, they're gone.
Okay.
That's incredible, how it reacts. But the thing is, if you get the scratch and you're gonna burn yourself, you're gonna hurt yourself, and that's gonna lead to a bigger lesion of psoriasis. So it's getting your hands in control is what's gonna get you at the end of the day. But people love scratching, and I get a lot of my patients, they come in, and they will use scissors, knives, pencils, whatever they can, to scratch their head. It's incredible because the itching is so far out. I mean, the more you scratch, the more it burns, but yet you feel some kind of relief. And that's why you keep doing it, because you feel some sort of relief, but you're hurting yourself.
Yes, of course.
Yeah, and causing scarring alopecia. I tell my clients when they do have psoriasis and not to touch it, like I try to tell them not to pick it because you're going to create a scab. But if they really have to, take some of their finger and press on it and rub, just to kind of like make the epidermis layer and the dermis layer kind of shift itself without scratching, or tapping to help, not scratching, tapping. That will help relieve a lot of that sensation. Just putting that little bit of pressure, or even like just putting some pressure on the spot, will help relieve a lot of that. And then as well too, you don't want to pick at it to cause more aggravation. You want to make sure that you're really cautious of what you're putting on your scalp too. I know when I'm in the shower, I'll rinse with a lukewarm to cool water, because I know with the hot water, it'll make the dry skin more dry and more itchy. So I'll do a lukewarm to cool water. My husband always laughs. He's like, you always have cool showers. I'm like, yeah, because it feels good on my scalp after, and I don't get the itch. Like, that's why.
Yeah, that's what I was about to say. As also, like, the ice packs, if you put the ice packs, it will cool the sensation out.
Yeah.
It works. It works. One of the things that I also like to use, the aloe vera gel with lidocaine. It works wonderful when it has the lidocaine on it, and it calms, it soothes. But again, it's not going to cure it or anything. It's just going to help mitigate with, of course, the burning sensation that you're
Mhm.
experiencing at that moment.
Yeah.
Now, here's the thing. Many people walk around telling themselves that they have psoriasis when in fact they have sebderm.
Right.
What
Wait,
you
wait,
guys
before
think
we
about
switch
that?
that,
Oh
I want
yeah.
to show you a quick trick.
Oh,
Aha.
that's cute. What is this?
This thing is a soap block that you can get. And what I will do time to time when my psoriasis flares up really bad, I'll take aloe vera, and I have fresh aloe vera plants all over my house, or you could get aloe vera gel at a health food store and you blend it and you freeze it. And I add vitamin D or vitamin E capsules as well to it
Excellent.
as well. And I'll put it in the freezer. And I have little blocks that will help on the days that I
Oh,
have a flare up. And that aloe vera and the vitamin E will help with any of the inflammation,
soothing.
swelling, and it helps soothe it. So just a little hack, you guys, go check
That
that
is
Do,
out.
do you keep those cold or
Yeah, in the
after that?
freezer.
Oh,
Yeah, you
that's
just make a
awesome.
couple,
just thinking about the cold, soothing it. Oh my God.
and it has a little bit, it's
Just
very
thinking about
soothing.
it.
Yeah, I'll use it just on
That's
days
awesome.
that it's really itchy, or if I've had a bad flare up, I just keep a couple in my freezer. And like I don't get flare ups all the time, but before I knew my triggers, I had bad flare ups. Like I was head to toe bleeding all the time. I couldn't figure it out. And I also have dermatillomania, which is trichotillomania, where I pick my scabs. So I needed those tools. So now I just keep a couple blocks in my freezer when I have a flare up. But honestly, because I know my triggers, I haven't had a flare up in probably
Exactly.
2 years now.
And that's the
So
thing, knowing your
Exactly.
flare-ups,
Mhm.
understanding yourself. Biz, you were commenting
Yeah,
something.
I want to actually exactly talk about knowing your triggers. So, as a functional medicine health coach in training, they teach us how to, like, if a person comes in like a psoriasis or any chronic condition, that you need to identify the triggers. So, the easiest free thing to do is to give them a food journal where they
Yeah.
can journal for 7 days, for 21 days, and then if it was a food trigger, or they can actually put where they were, like we went to the park today, I took the bus today, any kind of different situation rather than home or school or work. So basically, and then when the person flares up, we can, at the end of 7 days or 21 days, we can come back and see the connection. Is it a food related, or it is a environmental related, or what it is? So this is how the easiest free thing to identify a food trigger. And as a trichologist, we can start with this and then build it up. Then identify that trigger, try to figure out how we can remove it. And then as trichologists, we have all kind of tools to calm it down, as Kelly said, like all the tools that she was talking about, to just calm it down. And by removing the trigger, most likely it will go away.
Yeah. I wanted to mention, the importance again of following through and understanding what's causing it. That journal, it's a key. It's key for anyone. I mean, you want to understand what's happening to your body, you do a journal. You do a journal of what
Exactly.
you're eating, what you're doing on a daily basis, and by keeping that information, you can correlate it to what's happening every time you have a flare up on any kind. So it's not only for psoriasis. I mean, you can apply that for so many things in your life, and it's a great hack. And when you go to your doctor, and you be like, I have my information, I have my documents here, it will be easier for any medical
Yeah.
expert, to draw it down to, okay, this is where we need to go. This is the place where we need to revisit, and it makes it simpler. And it's good science. That's what it is. It's observation,
And
uh,
I think as all trichologists should actually use this free tool,
yeah,
right? Because all hair loss, except for the androgenetic alopecia, they have triggers, correct?
yep,
Am I?
yep.
Yeah. So I think all of us as trichologists should keep food journals to give it to our clients. I would say I'll give it to the client in the beginning of my first consultation, and then the follow-up, I'll try to do connections. If I didn't see connections, we keep digging until we find some.
Yeah.
I
I
well,
love the idea. Love the idea. Very important there. I have many. We're going to be talking about treatments later on, but one of the things that I wanted to mention, to help people differentiate between sebderm and
Yeah.
psoriasis, because again, you see a lot of people. They come to the office, for instance, and they be like, "Sergio, I have psoriasis." I'm like, "Okay, was that your doctor opinion, your diagnosis?" No, my own. I'm like, okay, we need to talk about it more. Because that's the
Right.
thing, people self-diagnose themselves constantly, and they don't know what's happening to them. And even psoriasis is the simplest form of dandruff. People can confuse it